Hello, hi, my name is Christy Johnny. Today I would like to present my case study. The title is Ochroconis gallopava. Introduction. Ochroconis gallopava, a recently recognized fungus which can cause infection in birds and immunocompromised humans. It often affects the central nervous system, leading to symptoms like headache, fever, confusion, seizure, and paralysis. Treatment is challenging, which involving antifungal drug and sometimes surgery, but relapse can occur. Survival rate vary based on the extent of infection, with better outcome in localized cases. Early diagnosis is vital, but further research is needed to improve treatment outcome. The classification of this Ochroconis gallopava is: the kingdom is fungi, phylum Ascomycota, class Dotidiomycetes, order Pleosporales, the family is Venturiaceae, genus is Ochroconis, and the species is Ochroconis gallopava. The case summary on the skin condition evaluation was these cases is patient is from Indian female which is 50 years old with hypertension history. Refer from Klinik Kesehatan Kuala Selangor for suspected psoriasis evaluation. The chief complained that the rashes on bilateral lower limbs persisting for 1 month. The previous treatment was provisional psoriasis diagnosis treated with topical medication and cloxacillin. The clinical presentation is like the picture: ring-like erythematosus scaly, patch on sins, vitis patch on finger and toes, nail changes. The impression of this from the skin evaluation is suspected fungal tinea and bacterial infection. The management plan was skin and nail scraping for the diagnosis, oral medication, symptomatic relief, adjunctive therapies, and 1 month follow-up for the treatment assessment, and basic blood test for overall health and metabolic abnormalities assessment. Okay, this one is the result for the lab diagnosis and interpretation. The specimen is taken from the nail scraping. Like we see here in the slide, the Ochroconis is isolated is Ochroconis gallopava. The identification of colony morphology from the front: the colony is smooth to sweet like dry flat tobacco, brown to brownish black with brown diffusable pigment. From the reverse side is tobacco brown to brownish black. The description of this interpretation for lab diagnosis is hype are brown with relatively thick walls. Conidiapores are mostly cylindrical to ocular, sometimes fully differentiated, bearing a few candida at the tip, 2 cells subhyaline to pale brown, smooth walk to very coarse, cylindrical to clavate, constrict at the septum. Okay, for the discussion of this case study, which is involved a 53 years old woman with hypertension refers for psoriasis management. She had persistent rash on her leg despite psoriasis treatment accompanied by nail changes. This symptom, along with her occupational exposure, suggested a fungal infection. Examination revealed erythematosus patch, nail changes, and vitis patch on her finger and toes is confirming the suspicion. Lab tests also identify Ochroconis gallopava, a fungus causing skin and nails infection. Treatment included antifungal, antibiotic, and symptomatic relief. The patient's presentation characterized by persistent rash and nail changes despite psoriasis treatment. Rash suspicion of a fungal infection. Examination findings support this suspicion with characteristic feature of a fungal infection observed. Lab tests confirm the presence of Ochroconis gallopava after isolated, a fungus known to cause infection. Treatment involved antifungal, antibiotic and symptomatic relief with 1 month follow-up to monitor progress. Okay, for the conclusion of this study is highlight the importance of considering fungal infection like tinea when patients have persistent skin and nail changes despite initial treatment. Occupational history, clinical exam, and lab tests are crucial for accurate diagnosis and treatment planning. Early tests Early recognition and targeted antifungal therapy are the key for favorable outcome and preventing complication. Interdisciplinary collaboration between dermatologists, infectious disease specialists, and primary care physician is vital for comprehensive patient care. Further research needed to optimize treatment for fungal infection caused by Ochroconis gallopava, especially in immunocompromised individuals. That's all for my case study presentation. Thank you.